watching Health and Wellness Myths and Facts. The topic of men's health, both physical and mental, is often swept under the carpet. It's important to remember that men's health is not just a man's issue, it's a family issue and can impact everybody around them. Hormones play a powerful role in the body's regulatory system. Proper hormonal balance is essential to maintaining optimal health and plays a crucial role in how one feels. While it is common to associate hormonal disorders and imbalances with women, many hormonal imbalances are seen as signs of aging or even inadequacies in men. Like women, men also undergo changes from childhood. These include physical and hormonal changes. Men tend to accept changes in their bodies as a part of the process of aging. However, most symptoms of aging are actually caused by hormonal imbalances. It is true that as men age, they are more likely to experience male hormone imbalance, but there are other contributing factors as well. Fortunately, male hormonal imbalance can be successfully treated. Living a long and healthy life is easy if you know the symptoms and the prevention strategies. Today we have with us eminent endocrinologists who will help you understand and manage men's hormonal health. Dr. Manoj Kumar Patil, diabetologist and endocrinologist from the Sushrut Hormone Clinic and Lab, Dhule, joins us. Dr. Velmurugan Manar, consultant endocrinologist, Vinayaka Mission University, Puducherry, is also with us, and Dr. Sharvil Gadve, consultant endocrinologist and diabetologist, Excel Endocrine Center, Kolhapur, also with us. Thank you, doctors, very much for sparing your time. Dr. Patil, the hormones created and released by the glands in your body's endocrine system could nearly control all the processes in your body. What are the male-specific hormones and their role in the body?
Yes, definitely the hormones are very important for male reproductive systems, and there are one of them is the testosterone hormone, which is very important for the male reproductive system. And so there is system of hypothalamic pituitary gonadal axis, where a hypothalamus releases the GnRH hormones, then it acts over the pituitary, releases the FSH, and then at testicular level it releases the testosterone hormones. So testosterone, which is at cellular level, become given to as a dihydrotestosterone, and it is very important for the various bodily functions. So it affects the various roles in the males, like maintaining the sex drive, libido, as well as well-being. Even it affects the spermatogenesis with the help of FSH hormone. Also, it important for the maintaining muscles and strength. Even the maintaining the bone density is also important part of testosterone hormones. Even during the pubertal changes, it is one of the important hormone which cause transition from the childhood to adulthood. Over to you.
Right. Dr. Velmurugan, can you enlighten us on what are the common hormonal disorders among men?
As the previous speaker pointed out, testosterone is a very important hormone for a male sexual function. So when there is a deficiency of this testosterone hormone occurs, then it causes a condition we technically call it as hypogonadism. So hypogonadism means here the patient will present with complaints of sexual dysfunction, which could be in the form of decreased sexual desire or erectile dysfunction, or in case of married couple, they may present with us to infertility. So this is primarily when we talk about a male-specific hormone dysfunction. When we see the picture as a whole, right, irrespective of being male or female, in the society that we are living, where there is an epidemic of diabetes and obesity, still diabetes and obesity is the most common disorder irrespective of sex, the hormonal disorder which occurs irrespective of sex. But of course, we have other disorders like your thyroid disorders, where there is an increased function, we call it as an hypothyroidism. When it the decrease in function of the thyroid glands, we call it as an hypothyroidism. They also fairly contribute a chunk of hormonal disorder in male. But on a whole, the most common being diabetes and obesity. To name specifically, it's a deficiency of the male hormone, that is testosterone.
Right, Dr. Gadve, what is male infertility and how common is it really?
So infertility is defined as the inability of a sexually active couple to achieve conception within 1 year of unprotected intercourse. So infertility, it is believed to be present in 15% of couples. Here we look at young couples, that is age below 35 years. Of all these causes of infertility, male infertility is believed to be the cause in almost 50% of cases, either alone or in combination with female factors of infertility. So the incidence and prevalence of male infertility is high. It is believed that 7% of males may face the problem of male infertility. The various causes of male infertility are known. Obesity, diabetes, thyroid disorders may be one of the contributing factors. Primary hypogonadism and secondary hypogonadism are specific causes of male infertility. Over the past several years, there has been an increase in the proportion of men facing the problem of male infertility, probably due to a lifestyle change and lot of environmental endocrine disruptors contributing to male infertility.
Right. Dr. Velmurugan, how is male infertility then diagnosed?
Yeah. So as with any medical illness, we start with history, that is talking to the patient. Okay, what does patient want to say to us? So especially if the patient is having deficiency of male hormone, the most important complaints they come to us is decrease in sexual function, that is in the form of decreased libido or erectile dysfunction, or again like there could be history of decreased shaving frequency, which some astute men could point out. But in case of married couples, again, their concern may not be the sexual dysfunction per se, but it could shift to an infertility, that is inability to have a child. So this is what they present to us. So after this, we tend to do some examination as for any other case, where we look for the axillary and inguinal hairs, whether they are normal or decreased, or testicular size, whether it's decreased or not. So once this part is complete, then we'll go for investigation. So investigation primarily include a semen analysis, where we examine semen for the quality, that is the concentration, volume, and the sperm count, the motility of sperms, and the quality of sperms, that is like how much of that is morphologically normal. All those parameters we tend to see in the sperm analysis. So once that is done, again we also do a blood investigation for hormone levels. The most important of which, as we have discussed already by my previous panelists, that is testosterone hormone, the level of which we tend to see, along with other hormones like LH and FSH.
Right, Dr. Gatve, the obvious next question then would be, what are treatment options that are available for male infertility?
So the treatment for male infertility will depend upon the specific etiology of male infertility that is diagnosed in a particular patient. Very common obesity, diabetes and thyroid disorders, if they are the contributing factor to male infertility, they should be managed appropriately. If hypothalamic cause or pituitary cause is diagnosed as the cause of male infertility, then there are a lot of hormone therapies which can be offered to the patient, which can increase the sperm count and help achieve conception in the infertile couple. When the cause of male infertility is testicular cause, then depending on the specific testicular cause, the therapy or the treatment plan has to be designed. Now, some men have problems of varicocele. It is a condition related to the testis. In that case, surgical intervention may be considered. When testicular cause is the cause of infertility, there are now options available in the form of testicular sperm extraction and ICSI, that is intracytoplasmic sperm injection. So these techniques can be used to help an infertile couple to achieve conception when the cause of male infertility is a testicular cause. Very important that whenever all these therapies are planned, a lifestyle change should also be advised. Weight loss in obese men can help in achieving good results for male infertility. Over to you.
Right, Dr. Patil, what are the causes of male infertility?
Yes, there are various causes for the development of infertility, like ranging from specifically sperm disorders, which may be in the form of decrease in sperm count or absent sperm, even the abnormal or abnormal motility or shape. So it may be caused by various factors like genetic factors like Klein-Pinto syndrome, AZF mutations, even the pituitary gland and the gonadal problems because of the pituitary tumor, and even we can say the various drugs like many of the substance abusers like anabolic steroids indirectly affect the testicular regions, and also childhood history of mums can indirectly affect the sperm testicular region. So in this way, the sperm disorder can be one of the factor, along with, as already pointed by the Dr. Sharvil Garge sir, that varicocele, which is one of the common problem for developing in the infertility, that as a because of the dilated weight around the testis, there is increase in temperature which affect the spermatogenesis and indirectly leading to the low sperm count. And also the obstruction in the conductive system of the from testicular level to the penile urethra, any cause leads to the obstruction leading to the infertility. And other various causes like retrograde ejaculation is also one of the form. Also the various drugs used in chemotherapy and can indirectly affect the testicular region and leading to the infertility. So we have to look for the various causes and guide appropriately to the patients.
Right. Well, with that, we're going to slip into a very short break. We'll continue this conversation on the other side. Stay with us. Back, you're watching Health and Wellness, Myths versus Facts. Dr. Bartley, if I can come to you. Speaking of causes, can stress be one of the causes for hormonal changes in men, and how does stress affect your testosterone levels?
Yes, definitely stress is a very important part in development of the male infertility. So basically, often we face the patient male couple presenting stressful male couple presenting with the infertility, and if you look at that, stress create a flight and fight response, and which leads to the increase in cortisol levels in the body, and indirectly it releases the GnRH, we can say the gonadotropin releasing inhibiting hormones. So indirectly leading to the FSH lower response and ultimately leading to the low testosterone levels. And also along with it, it increases the prolactin hormones and also decreases the dopamine. So indirectly decreasing the libido and sexual drive and ultimately affecting the sexual life. Even if you look at the during pubertal development, if it is associated psychosocial problem in a child, it is often leads to the poor development of the, or we can say the poor progression of the puberty as well as growth hormone growth of the child. So definitely stress is one of the important factor and can lead to the affection of the infertility. And good thing is that we can elevate the stress factor and can improve the quality of the life patient and even fertility to the patients.
Right. Dr. Velmurugan, is it true that men who are overweight or obese are more prone to lower levels of testosterone?
Yeah, exactly, that is true. To just understand this problem better, first we should know what is obesity and overweight as per the Indian population. So we define these things by a parameter called as body mass index, which uses our height and weight to calculate the parameter called as body mass index, as I told you. So when this index is more than 23 for an Indian, we call the person as overweight. When it is more than 25, we call the patient as obese. See, this obesity and overweight has become very quite rampant, like such that it has become a pandemic. Like, so we all know the COVID pandemic existed for the past 2-3 years, but this pandemic is existing for the past 3 to 4 decades or so. Okay, so this is basically the way that we live. Life has quite drastically changed from our ancestors how they lived. Okay. So, like, when obesity is there in such a high prevalence status, especially like 1 in 2 individuals, 40% of our Indian population, as per the recent data, suggests they are either obesity or overweight. Now, we all know about the complications of obesity, especially people are very well aware about it can cause diabetes, it can cause heart elements, it can cause sleep disorders and all those stuff. But very few people are aware that this obesity has also linked with a crucial male hormone, that is testosterone. So it has been found that many people, especially who are extremely obese or morbidly obese, I will say, whom the BMI is more than 40, they tend to have very low level of free testosterone, which is important hormone for the normal sexual function. So as you said, the testosterone hormone levels are lower in individuals obese.
Right. Dr. Gadve, mental and emotional symptoms such as fatigue, depression and poor memory are also commonly seen in men as they age. Is it true that hormonal imbalance in males, this is something that is due to hormonal imbalance in males and that they are more prone to metabolic disorders as they age as well?
This is a very, very pertinent question. Often these symptoms are not given appropriate attention. So any elderly male complaining of fatigue, tiredness, depression, change in the quality of life should always be assessed appropriately. One of the important factors which contributes to all this is the hormonal changes that occur with aging. All endocrine glands, there is change as a male grows older. The most common which we know is diabetes and thyroid disorders. These are also more common in men as they grow older and should be appropriately treated. Then comes something what is known as andropause. Now we know that in females there is a process called menopause, which is commonly heard about and talked about. But in men there is a condition called andropause, which simply means as men grow older, the level of testosterone, there is a gradual decline. Now there is a condition in elderly men called late onset hypogonadism, that is substantial decrease in the testosterone levels, and this needs to be treated. This requires a proper assessment and treatment by an endocrinologist. It can dramatically improve the quality of life, decrease morbidity, decrease mortality. Also there is a condition called somatopause, that is as males grow older, there can be decrease in the level of growth hormone and a hormone called IGF-1. All this contributes to poor quality of life, and often these problems are undiagnosed and patients don't receive proper attention. But if diagnosed at appropriate time and proper treatment given, they can dramatically improve the quality of life. Also, they can decrease the risk of sarcopenia, which is another very common problem in aging men, that is loss of muscle mass, which can also contribute to the risk of falls. There is also a condition called osteoporosis in elderly males, which again is due to changes in the hormones. So any elderly male presenting with fatigue, depression, poor quality of life should always be appropriately evaluated and proper treatment be advised.
Right. Very interesting. It's also said, Dr. Murugan, that there are some specific types of medication that can also change the balance of testosterone in a man's body. Is testosterone replacement therapy therefore helpful in such situations?
Yeah. See, there are many medications that we tend to use for patients that can lower your testosterone levels. So this is very pertinent, especially for drugs that we use for anxiety, depression, that is these psychiatric medications. They have an impact on testosterone levels and decrease its level. Okay. So apart from that, another group of drugs, that is opioids. This could be from two sources, one from doctor per se, where we tend to use morphine as a painkiller for a certain patient, and other form where people tend to get exposed to opioids is by drug abuse. So these are the two important drugs that we tend to use commonly in medical practice, can lower testosterone levels. Apart from this, we have one another group of drugs, that is chemotherapeutic drugs. These are the drugs that we specifically use for cancer therapies that can directly have an impact on your testes and decrease the testosterone levels. So when these drugs are impacting testosterone levels, the way that we treat depends upon what is the drug that is involved. For example, if there is a medication that could easily be stopped, okay, which could be easily stopped, then that could be the treatment for the low testosterone level that occurs due to that medication. But for other medication which is very essential that we cannot discontinue it, for example, for cancer medications which are quite important, then we tend to continue that medication, but simultaneously for decreased testosterone levels, we give hormone replacement therapy.
Right, Dr. Gatwe, a healthy lifestyle is a cure for all essentially. Is it true for the male body also? Can a healthy lifestyle perhaps reverse problems associated with hormonal imbalance?
Yes, so in fact, in terms of the hormonal changes that occur with aging, it is very, very important that we advise our patients a healthy lifestyle, which includes a proper balanced nutrition. Often we see that elderly people are having diets deficient in protein. So a proper balanced nutrition with adequate protein content and taking care of all the micronutrient deficiencies, especially vitamin D deficiency, vitamin B12 deficiency should be managed well. Healthy lifestyle also includes the advice of exercise, even to elderly males. Now, it's a common myth that elderly people should not exercise or do certain forms of exercise. That is not true. In fact, irrespective of age, all elderly males should be advised appropriate exercise, which should include balanced between aerobic exercises and age appropriate weight bearing exercises also. That is very important, because if elderly males are not doing appropriate weight bearing exercise, that can lead to sarcopenia, that is loss of muscle mass. Also included in lifestyle advice is adequate sleep. Elderly males who have sleep deprivation, that can lead to change in their circadian hormone rhythms, that can again lead to lot of hormone related problems. It can exacerbate their diabetes, it can exacerbate their hypertension. So proper exercise, proper dietary advice, healthy nutrition and adequate sleep are very important to have a good hormone health.
All right. Thank you very much, doctors, for joining us in this edition of the show.
Thank you.
Thank you.